Hi, I'm Dr. Ted Arkfeld with Arkfeld Advanced Chiropractic in Gaylord, Michigan, and this is my ARPneuro story. It really starts about 3 years ago at the height of the pandemic when we brought ARPneuro into our facility. And I have said throughout those years that ARPneuro kept us going through the height of the pandemic. When multiple other offices were closed, we were still open. We were seeing patients in pain. We had rotator cuff patients that were due for surgery. We had hot disc. We had knee problems, post surgical knee, you name it, we saw it. They were coming because we were the only place they could turn to because the orthopedic surgeons weren't open. Physical medicine was not open. They were coming to see us. They wanted a different alternative. And you know what? We got those people well. I've been in practice for 35 years. I had never heard the word miracle used so many times up until that time. Every patient would come in and they would say, "This is a miracle." And I got to tell you, I have seen so many things come and go between spinal decompression and laser therapy and MF and this and that. Okay. And we have a lot of cutting edge equipment and therapies in our office. But the ARPneuro is by far the best thing that we have for getting people moving, for getting people to restore their normal functional activities of daily living, and getting them back out doing what they need to do. It is truly a neurological therapy, and I've actually built a whole program now around it called the Neuro Way to Practice program. We have gotten people stronger, faster. We've been able to keep them from surgery. We've taken chronic post-surgical low back cases that thought there was nothing else that could be done for them, and we got them to get back into their normal daily living. We actually had one just send a Facebook post this weekend. They were down at spring break and they were able to scuba dive, and they put on the Facebook post that never would have happened without what we did for them. Well, what we did for them at the clinic. So if you're on the fence, patients, find somebody that's an ARPneuro. Find the nearest ARPneuro clinic in your area. If it's Michigan, come see us. Otherwise, doctors, if you're on the fence, you chiropractors, this is exactly what we need. It's the best adjunct to what we do with spinal manipulation. You can help so many more people, and it's fun. So, ARPneuro, increased movement, and you know what? The other thing, doctors, you increase your reimbursements too. Thank you.